why it was so important for you to propose the session on war and public health?
Yes, my topic. I think that war is a disaster that is 100% man-made. And we have a lot of problems in health. And we want to protect people and avoid ill health. So war is something we really can eliminate.
What are the main direct and indirect consequences of the armed conflict on public health?
Well, the direct ones, people are killed and injured, but also the consequences on sanitation. Suddenly water supply is lacking, and then we have the increase of communicable diseases. That is the direct. But the more important is generations after will suffer mental disease. We know from epigenetics that once you have a trauma, you will give it to your grandchildren and your grandchildren.
In this complicated context, in your opinion, what role should play public health professionals?
I think that we, as public health professionals, really have an important role to play. We do see the problem as a preventable one, and we also know that the common thought of oppression is the only way, only leads to military security, but has barely nothing to do with the security of the majority of people. So we have to become advocates for mediation instead of war.
How do the wars, in particular the one in Ukraine, affect public health?
War in all parts of the world, but more specifically in Ukraine, has badly affected the health system, health of people, and the health determinants and outcomes in the longer term. Infrastructure is distracted and the health service delivery is disrupted. Focus and investment in health, both financially and politically, is badly affected by the ongoing conflict, and it will even further worsen in the longer term.
Are donor programs truly capable of resolving all pressing issues that Ukraine health system is facing, and are they well aligned with the national agenda?
We should, in every country, should appreciate the efforts and intervention of donors at such a critical situation, but it is a reality that no donor intervention or external aid can replace the national health system. It is not unique for a specific case, but for Ukraine, it is applicable as well. So there are aid, it is effective, but there are huge gaps in service delivery. Sustainability is a big issue, and vertical projects in the short term has its effectiveness, but in the longer term, it badly affects the sustainability, quality, and alignment of service delivery at national level.
How many years, in your opinion, will it take for the Ukrainian healthcare system to recover quality parameters similar to those that existed before the conflict?
Well, conflict has a multifactorial effect on people's life. And it is not a matter of years, it is a life course matter. It will take generations, decades for a country to rebuild its systems, including the health system. Health systems they do not exist in silos. They exist in a society, in a country, in a governance system where other determinants has its positive and negative effects on the health system. So for Ukraine and other countries, our experience in Afghanistan says that it will take decades, it will take generations and life courses to rebuild the infrastructure, expectations, health determinants, and the capacity to ensure sustainable service delivery toward UHC in Ukraine and other conflict-affected and fragile contexts.
And if you compare with the Afghan conflict and the system that you have, can you make a comparison?
I believe that Afghanistan sets a great example of what is strengths and weaknesses. In Afghanistan, good or bad, we had decades of experience. So the system, people, and our donors all had a great level of resiliency. So we were shocked several times, And after the collapse of the regime, we could sustain service delivery in short term in 98% of our health facilities. It is not the case in Ukraine. This is their first example, first experience of facing such a disaster, which I feel very sorry for that. So it takes time to build the resiliency not only within the health system, but within the society, the donors' capacity, as well as other determinants and factors which positively and negatively affects the health system. So, in short, what I want to say is that conflict affects people's life. Health is one of the significant parts which is badly affected not only directly but indirectly as well. Our experience in Afghanistan has proven that it takes time, it takes energy, it takes courage, and unfortunately it takes lives and resources to sustain the health service delivery, to rebuild it, and to improve the quality and quantity and access to healthcare services when conflict is going on there, and even in post-war situations.